has been found that parents tend to use fever medicines even with slight hint of fever in children. Is it really necessary to use fever medicine every time? Why kids get fever? Fever is one of the defense mechanisms of the body to fight the infection. So, reducing fever every time means you are in the way of the body's mechanism and obstructing it. When do we go to pediatrician? Any infant less than 3 to 6 months age with temperature above 100 Fahrenheit should be examined by the pediatrician. Above 6 months to 6 years fever crossing 101 Fahrenheit would be examined by the doctor. If the child is mostly comfortable and taking liquids well, can be treated and observed at home. Can fever medicine cut short the infection? Fever medicine cannot cut the infection duration as it cannot fight the infection. Use of fever medicine is to bring comfort to the child and to stop it from rising in those young kids who can have febrile seizure. Every child does not have that. So use the medicine when child is uncomfortable with fever. Even if it's low, you can give fever medicine. But, for example, if a 6-year-old child with fever 101 Fahrenheit is playful and comfortable, can be observed and may not need any treatment for fever. What to do if child is empty stomach? Still, you can use fever medicine if child is empty stomach. Maybe because of fever he is not able to feed well. How much medicine should I use for fever for my child? Paracetamol dose is 10 to 20 milligrams per kilo. Maximum recommended dose per day is 60 milligrams per kilo per day for children. Upper limit for adults is 4 grams per day. It can be divided in 3 to 6 doses in 24 hours. For kids younger than 1 year, 10 milligrams per kilo per dose is preferable. Ibuprofen dose is 4 to 10 milligrams per kilo per dose, can be given 3 to 4 times a day. Maximum dose in adults is 3,200 milligrams per day. Diclofenac is used between 0.5 milligram per kilo per dose to 1 milligram per kilo per dose, not to be used more than 3 times a day. Always discuss the dose and duration with your doctor, because it depends on various factors. How much gap is needed between paracetamol and ibuprofen or diclofenac? Try to keep a gap of 4 to 6 hours between 2 doses of paracetamol, 6 to 8 hours between 2 doses of ibuprofen, and 8 to 12 hours between 2 doses of diclofenac sodium. However, gap between doses of paracetamol and ibuprofen can be 1 hour even in case of need, when child is having high fever and is uncomfortable. But along with medicine, try to give oral liquids, and tepid sponging with cold water can be done all over the body. Hope this helps you to take better decision. Take care.